Hello, everybody. Time is really going quick this year. Welcome to What's Next, the world of endotoxin, and I'm your host, Brendan.
And I am Oya, and we are at episode 4 of What's Next. Today's episode is very exciting. We have with us one of the discoverers of the LAL test and arguably the most famous name in the endotoxin testing, Dr. Jack Levin. Welcome.
Hello.
Thanks for coming along today. So, we just want to ask you a few questions. As a discoverer of the LAL test, or the LAL clotting process, what was your interest in studying the hemolymph of the horseshoe crab at the time?
I was a research fellow in the hematology division at the Johns Hopkins University School of Medicine. Dr. Fred Bang, who was a professor in the School of Public Health, contacted my chief at that time and asked if he had a junior person who could come join him for a summer of research at the Marine Biological Lab in Woods Hole, Massachusetts. Approximately 10 years previously, Dr. Bang had observed that a bacterial infection caused coagulation of the blood of Limulus, the horseshoe crab, but he had put this work aside. Subsequently, he decided to pursue this interesting observation, but not being a hematologist and having no experience in blood coagulation, he sought assistance. At that time, I was studying blood coagulation and blood platelets, the cell which plays an important role in preventing one from bleeding. And as a result, my chief suggested that I join Dr. Bang to help him make some progress with his previous observation. And therefore, I went to the Marine Biological Lab to study blood coagulation in Limulus. My major focus was intended to compare the Limulus amoebocyte, the only circulating cell in the blood of Limulus, with the human blood platelet and look for comparisons. So that's the basis of my going to Woods Hole in the first place.
Interesting story. And how did you come to discover that Limulus blood was able to detect bacterial endotoxin?
Well, as I just said, my original focus was to compare the Limulus amoebocyte with human blood platelets. And in order to study a cell in the blood, one has to keep the blood from coagulating. Otherwise, the cells are trapped in the clot and one cannot work with them. I started using the usual anticoagulants to prevent Limulus blood from clotting. And no matter which one I used, they eventually failed and my work came to a roaring halt. I was stumped as to how I could proceed. And then I recalled the work that I was doing in Baltimore at that time, which included studies of blood coagulation in the rabbit. And what I had been studying was the effect of bacterial endotoxins on triggering blood coagulation in the rabbit. And with that background, I considered the possibility that bacterial endotoxin could be triggering clotting in Limulus. And when I prepared endotoxin-free glassware and scrupulously handled the blood samples, Limulus blood did not clot. And that revealed to me that Limulus blood was sensitive to bacterial endotoxins. Now, the audience has already heard a considerable amount of bacterial endotoxins, and I just want to remind the audience that endotoxins are ubiquitous and present in every gram-negative organism. And these are not obscure organisms. So, for example, meningitis is caused by a gram-negative organism. So is typhoid fever. And almost every year there is an epidemic of illness due to E. coli. So this was not an inconsequential issue. When I realized that the system was sensitive to bacterial endotoxin and I could prevent clotting from happening, I was then in a position to start evaluating blood coagulation in Limulus.
So Was it something immediate that happened, or how long did it take you to truly understand the importance of this discovery, especially for bacterial endotoxin testing in pharmaceuticals?
Well, I didn't originally realize its great implication. At that time, I had no really experience with the pharmaceutical industry. Of course, I knew that the rapid pyrogen test was used to test for endotoxin in drugs, but I had no idea of the order of magnitude of the testing. My focus was really on biomedical research. Now, there are many experimental systems, both in intact animals and in vitro, which are sensitive to bacterial endotoxins. And up until the availability of the Limulus test, research laboratories had absolutely no way of determining whether endotoxin was in their reagents, since in many instances the presence of endotoxin produced incorrect data. It really was a major issue, which tended to be overlooked because nothing could be done about it. It was obviously impractical for research laboratories to perform rapid pyrogen tests on every reagent. And so my focus was on the use of the Limulus test in research laboratories, and in which it was gradually adopted. And if one reads many current biomedical research papers, where it's appropriate, you'll see buried in the methods that the Limulus test was used to rule out contamination with bacterial endotoxin. So that is what I saw as its major importance. Again, to remind the audience that endotoxin is ubiquitous. It's present on tabletops, it's present in your drinking water, but fortunately in concentrations that are too low to cause a problem. So to get to the point, I did not foresee its enormous use in the pharmaceutical industry until some time had passed.
Well, I want to thank you for your time today, Dr. Levin. Personally, I think you've made a major impact, not just in endotoxin detection, but the ability, what this endotoxin test has actually made a complete overall improvement of the quality of pharmaceuticals for all. So, well, thank you so much, Dr. Levin. Our next episode, everyone, will be on endotoxin and pyrogens, and we'll have another expert in the field that will come in and share their knowledge and experience with us. So, thank you, Oya. Thank you, Dr. Levin. And remember, as we say, stay safe, get vaccinated, wear a mask, wash your hands, and have a good day. Thank you, everyone.
Goodbye.
Thank you, Dr. Levin.